Hey everyone, Greg Staley here from Diverge Media. We're going to be talking about the stay-at-home orders being extended here in Ontario and some of the things that you may have missed and some other things in the news that we think are relevant. So, here we go. They say to save lives. This is as of February 8th, 2021 from the Office of the Premier, put out on newswire.ca. Toronto, in consultation with the Chief Medical Officer of Health, the government is moving to a regional approach and maintaining the shutdown in the majority of the public health regions in Ontario, including the stay-at-home order and all existing public health and workplace safety measures, when it is safe to do so, which is perceivably never, according to this government. So when will it be safe to do so? Good question. The province will gradually transition each region from the shutdown measures to a revised and strengthened COVID-19 response framework, keeping Ontario safe and open. The framework's there. Details were provided today by Premier Ford, Christine Elliott, and the whole crew. We must also consider the severe impact COVID-19 is having on our businesses. That's why we have been listening to business owners, and we are strengthening and adjusting the framework to allow more businesses to safely reopen and get people back to work. To support the province's economic recovery, the government has updated the framework to allow for a safer approach to retail. Safer approach means extremely diminished earning capacity approach to retail. Limited a person in shopping and gray lockdown zones will be permitted with public health and safety measures such as limiting capacity to 25% in most retail settings. In addition, public health and safety measures in retail settings will be strengthened for other levels of the framework. Individuals will also be required to wear a face covering and maintain physical distance when indoors in a business, with limited exceptions. Other measures include a requirement for individuals to wear a face covering when attending an organized public event or gathering where permitted, if they are within 2 meters distance of another individual who is not part of their own household, both indoors and outdoors. This is something that maybe hasn't received the coverage it deserved, but protests, it sounds like they might be trying to demand social distancing now and the wearing of masks. Ironically, in a protest where you might be protesting those exact things like social distancing, like mandatory masking. The following 3 regions will be moving back into the framework at the green prevent level on Wednesday, February 10th. So if you're a part of these, you're going back to the green. This whole levels to your freedom, what freedoms will I get back? It really just irks me the wrong way. Green, yellow, orange. Get out of town. Hastings, Prince Edward Public Health, Kingston, Frontenac, and Lennox Addington Public Health. Ironically, Randy Hillier's comes out in Renfrew County and District Health Unit. So there you go. Due to the fact that public health trends are improving in some regions faster than others, the current stay-at-home orders will be amended. It is proposed that the stay-at-home order will continue to apply to 28 public health regions until Tuesday, February 16th, 2021. Oh, just a little bit longer. You might get your freedoms back in a week or two. Oh, just a little bit longer. Final decisions will be subject to review of the trends and public health indicators at the time. While we have seen some progress in our fight against COVID-19, the situation in our hospitals remains precarious, and the new variants pose a considerable threat to all of us, said Minister Elliott. Pump the brakes. I am getting sick and tired of hearing about this new variant. The UK variant is so new. It's been around since September, everyone. CBC, I believe, reported on it, but I know it has been around since September. Regardless of who reported on it, it has been reported on. This isn't a new variant, and the fact that it only makes up 5% of cases now, with over 1 million international flights arriving monthly, says all I need to know about it. Well, they continue. As we have cautiously and gradually transitioned out of the province-wide shutdown, we have developed an emergency brake system, giving us the flexibility. An emergency brake system. We can steal all your rights away at the pull of a lever, at the pull of the emergency brake. We can just shut down business. And whenever we feel like it. Isn't it great? We have developed an emergency brake system giving us the flexibility to contain community spread quickly in a specific region, providing an extra layer of protection. Oh, just a little bit longer. You might get your freedoms back in a week or two. Oh, just a little bit longer. Isn't it great how we can just shut down and turn your life upside down at a moment's notice? Isn't that fantastic? Thanks, Minister Elliott. Recognizing the risk posed by new variants to the province's pandemic response, these variants that have been around in reference to the UK variant since September, Ontario is introducing an emergency brake to allow for immediate action if a public health unit region experiences rapid acceleration in COVID-19 transmission or if its healthcare system risks becoming overwhelmed. No indication as to what the metrics would be that would confirm that that is occurring. If this occurs, the Chief Medical Officer of Health, in consultation with the local Medical Officer of Health, may advise immediately moving a region into gray lockdown to interrupt transmission. So now, they may advise, a Chief Medical Officer of Health in the region may advise immediately to move that region into a gray lockdown to interrupt transmission. While we are seeing our numbers trend in the right direction, our situation remains precarious, as the variants of concern remain a serious risk, said Dr. Williams. While we see our numbers trending in the right direction, this is not a reopening or a return to normal, and we must continue to limit close contact to our immediate households and stay at home except for essential reasons. Because seeing your family and friends and your mental health is not essential. Because going to church to get your heart right with God is not essential. Because the only things that the government deems essential are liquor, beer, and food. And to continue, this is not a reopening. They say it's not a return to normal. Just thought you should be reminded that it's not a return to normal. By continuing to follow all public health and workplace safety measures, we can continue to reduce the number of new cases and the strain on our health system, Dr. Williams said. All right. In addition, the provincial government declared, under Section 7.01 of the Emergency Management and Civil Protections Act, EMPCA will be allowed to terminate at the end of February 9th, 2021, while the province-wide stay-at-home order will cease to apply in some regions as of February 10th, 2021. Everyone is strongly advised to continue to stay at home, avoid social gatherings, minimize travel between areas with different rules, and limit close contacts to their households. Employers in all industries should continue to make every effort to allow employees to work from home. Unbelievable. The biggest thing that needs to be approached is long-term care and retirement home facilities. The full picture of things, the economic consequences, mental health and physical health consequences long-term of lockdowns and these measures. We don't think about that and the potential impacts they will have on our healthcare system. No, we don't think about the long-term consequences of the actions. We just think about the immediate short-term gratification that is a marginal improvement at best that comes from lockdowns. Oh, just a little bit longer. You might get your freedoms back in a week or two. Oh, just a little bit longer. This is the government's approach. Everything short-term, everything right now, nothing considering the long-term consequences. They say they're considering it. We've heard from small business owners. Well, no, you haven't, because, again, small business owners are literally taking out loans in hopes that one day the government will stop punching them in the face, so to speak, and let them open their business and run again. Because right now they're happy if they can just maintain even, not even make a profit, just maintain, not putting more debt into the reality of their life. We have all cases. This is COVID-19 Ontario.ca data. A reproductive rate of 0.9, so less than one reproductive rate now. This is an estimate of the average number of people that one person with COVID-19 will affect. So I want to show you one thing here. This is new cases. This is the 7-day average trend, that line there you can see. We went into lockdown on December 26th. I think it peaked out at, sorry, it's touchy here. Peaked out at roughly 24.34 cases per 100,000 and has been declining since, it looks like it's since the 10th of January. And now we're into February. So new cases, 7-day average is 1,367, 9.38 cases per 100,000 versus 15.49 cases per 100,000 when we locked down. So we've been consistently declining since about the 10th of January, and yet only 3 of the areas are going to be going back into green zone. Here's the death counts, number of deaths reported each day, and just show you the spike here. This is, I believe, a data cleaning initiative. And we're coming back in the flu season, and we're going to see a slow trend. It looks like we're probably into almost our peak, and we should be starting the downward trend back out. So there's that there. The effective reproduction rate, it's consistently been lower, and it's at 0.9 right now. And we went into lockdown December 26th. The reproductive rate at the time was 1.1. We're now at 0.9. So this is tests completed in Ontario. This is first. So this is the beginning of all this. We're doing 9, maybe 20,000 tests a day in June End of June, we're getting up to about 30,000, 25, 30,000 a day. Here's where we are now. 60,000 plus, and then they'll drop, and you see the pattern here. A bunch of high spikes all together, and then drop a couple days low. Up, low, up, low, up, low, up, low. So this is kind of the pattern where they'll run 3, 4, 5 days at a higher amount of testing and then drop it to 35, 40,000, which is still higher than all the testing we were doing in April, June, July, August, September even. We get into September, we're like, our low numbers now are our high numbers in September and October. So that's where we're at. We're testing upwards of 50,000 to 70,000 plus sometimes a day. You can see, and then we'll drop it down to 34,000 within a day or two. And this has been the repeated pattern. So the point on all that is when we go into PCR testing, we had a study, we covered 3,790 positive PCR samples were tested, okay? And they tested to see if they could actually infect another cell culture. And it could be observed that at a cycle threshold equal to 25, up to 70% of patients remain positive in culture. Meaning, if the cycle threshold was up to 25, 70% of patients were actually infectious when they went to infect another cell line. 70% were actually positive PCRs. At a cycle threshold of 30, this value drops to 20%. So only 20% of those at a cycle threshold of 30 were actually infectious. At a cycle threshold of 35, the value we used to report a positive result for PCR was less than 3% of cultures. That was run by Oxford Academic. So this matters when we're talking about this. Well, in Ontario, as we've covered before, if you go to our bombshell PCR article, we put in the testing rates across Canada and what the PCR cycles are across Canada, 33 to 45. And in Ontario specifically, we run at 40. So if you have a academic article, a medical study saying that they tested roughly 3,800 people and tested them in culture to see if they can infect others, and out of those, less than 3% of those above 35 cycles could actually be cultured, don't you think it would be problematic to know that Ontario runs their cutoff at 40? Well, that is the situation we're in as Ontarians, as Canadians. We have a cycle threshold of 40 cycles. This means that less than 3% chance of those actually being positive. If they tested positive at 35 or over, less than 3% chance of those cultures actually being positive and being able to infect another cell line. So I've set out the question to the Ministry of Health, just what's the breakdown of the percentage of our total cases based on PCR thresholds? How many cases were above 35 cycles? How many cases were 30 to 35? How many cases were below 25? If the majority of our cases, 80-90% are below 25, it's likely that they're actually infectious. But as we've increased testing from 15, 20,000, 30,000 was a high day at the beginning of the first wave, you would say, the first lockdowns. We're now up to 65, 70,000 plus, and then we drop down to 30, 40,000 on a low day. And then you find out we amplify at 40 cycles in Ontario and 33 to 45 across Canada. The question needs to be asked, well, how many of these people are actually infectious? How many of these people are actually able to make someone else sick and spread what they have? We already know that asymptomatic spread is extremely rare. That is why Diverge Media has advocated for the end of mandatory masking. We know that in 2018, the Ontario Nursing Association won a court case where they didn't have to mandate mask on nurses who refused the influenza vaccine. They wanted to have a VOM policy, a vaccine or mask policy. And the court struck it down, not once, but twice. 2015 and 2018, they struck it down because there wasn't sufficient evidence that the mask was protecting the wearer or the patient from getting influenza. The coronavirus particles, nanoparticles, are smaller than that of influenza. So that is a court precedent that has been set that hasn't been talked about. In addition to asymptomatic spread being extremely rare, less than 3 to 5% of known cases, according to Dr. Maria Vera-Kirkov of the World Health Organization early on. This was months and months and months ago. And then we have a recent study out of Wuhan, China. You can look this one up. 10 million residents were tested roughly. 300 tested positive for asymptomatic PCR positive test result. And out of the 300 that were positive PCR test results, meaning they were sick and infectious according to our government here in Ontario, well, 0 were actually able to infect another cell line, proving infectiousness. This would indicate that asymptomatic spread is extremely, extremely, extremely rare. Out of 10 million people tested, less than 300 were actually positive. Out of those 300 people, 0 were actually able to infect others. Now, this doesn't mean asymptomatic spread doesn't occur, but it does mean out of 10 million people tested, there was only 300 people that tested positive, and out of those people, 0 were actually infectious. This greatly calls into question our current approach. Why are we punishing the healthy people? You say pre-symptomatic spread is a big thing. They say 40 to 50% of cases could be pre-symptomatic spread. What about somebody like myself who has 0 symptoms? Not even a runny nose, not a nasal drip, nothing. No, they've taken that power from you and said you can't make up your mind on that anymore. But I'd like to put out on the other side, if you're wearing a mask, it's actually a lot easier to hide symptoms of sickness, and that was one of the concerns that experts had initially with mandating masking. That, and they're only good when worn under the perfect conditions. They need to be changed out frequently. They can't be moist or dirty or anything like this. And how often have I personally seen somebody pull out a wet, a dirty, or a otherwise not appropriate for use face mask to put on their face before walking in a store? It's all stained and crumbs and stuff on it. It doesn't matter. So long as something's on your face, that is what society has said. If you're sick and you go out with a mask, you're still spreading the virus. In fact, you're probably more dangerous than any asymptomatic person ever could be. But we don't talk about that. If you have no symptoms, you're not going to be spreading this thing. Very, very unlikely. And when as a society, and this is my whole argument against getting rid of mandatory masking, when as a society have we ever focused on the smallest part of a problem? When have we as a society ever focused on the less than 5% portion of a problem? That's asymptomatic spread. We know that the predominant majority of cases come from workplace and congregate living settings like retirement homes, long-term care facilities, and facilities like where you're canned in close quarters and you're close with somebody and you're working for prolonged periods of time. Those are where the cases are coming from. Those are where they need to be addressed and mitigated. We need to find ways to deal effectively with long-term care and retirement facilities, but we haven't to this point. So my question to you is, if there's a court case in 2018 that set the precedent that masks were not effective in preventing transmission of influenza and COVID particles are smaller than influenza, then why aren't we hearing about that today? Mandatory masking, as the NEJM talked about, is a talisman that gives people a perceived sense of safety. It's something we feel we can do. In the healthcare settings, it's a marginal benefit at best worn in the perfect environmental conditions. And environmental conditions are anything but perfect in the general public when it comes to masking. Oftentimes people are reusing masks, and oftentimes the biggest irony I can see with the mandated masking is the premier and the health minister coming out after experts have said, don't fiddle with your mask. You could be spreading COVID. And they come out and it's a big virtue signal for everyone. And if this is the mask, they go, oh, hey, I'm Doug Ford. I'm going to come up. Oh, look, let me take off my mask. Oh, okay, now I'm going to put it back on. Oh, next speaker. Oh, take off the mask. And all I see is virtue signaling, because every time you fiddle with your mask, you are told by an expert that that's exactly what not to do in order to stop the spread of COVID-19. And what do you think people are understanding? Is that it doesn't matter how they wear the mask. It doesn't matter the condition they wear the mask. It doesn't matter if they crumple the mask up, put it in their pocket. It doesn't matter how. Just put it on. And this is not new for this premier to be sidetracked with things that seemingly don't matter. We remember the Kawartha's ice cream, just a little bit out of touch. Well, recently the premier, he talking about the reopening of Ontario, decided he would plug the the real eggs of Tim Hortons during the press conference. So I'm going to read a little bit from that for you now. So Doug Ford gets sidetracked and plugs Tim Hortons' real eggs during press conference. Give Timmy's a good plug. The best thing you guys ever did was make those real egg sandwiches. I used to go eat those other ones. They are the best, those real egg sandwiches. So whoever did that at Timmy's, thank you. So he took time out of his press conference speaking about the reopening to plug a nice little story and then use it to ultimately plug Tim Hortons, a massive corporation. So let's just hear his words on that not mine.
We're going to go down University Avenue and hand out these Timmy's card. Oh yeah, I got to give Timmy's a good plug. The best thing you guys ever did is make those real egg sandwiches. I used to go eat those other ones. They're the best, those real egg sandwiches. So whoever did that at Timmy's, good for you. And as for the Leafs mask today, lovely lady from Etobicoke made these in her house. And go Leafs, go. We're going to go down University.
There you go. Small business can't handle any more ongoing lockdown measures. Business in general can't handle any more ongoing lockdown measures. Jobs are in the balance. The future of our economy and of our province and of our province citizens is in the balance. Ontario can't afford to do this anymore. Lockdowns can't go on indefinitely. Businesses must open. We must protect the most vulnerable and allow those who aren't at major risk of this virus, those under the age of 60, without comorbidities, to get back to work, to get back to making this province roar again, so that we have the tax income to keep the healthcare system going, so that we have the tax income to help those in need. Ontario needs to get back to business. We need to open up. We need to do so while protecting the most vulnerable. People under the age of 60 that aren't at major risk of this virus can go to work safely. This can't continue like this. Businesses can't continue like this. They weren't designed to operate like this. And if they're fortunate enough to have been able to hold on during this, many of them have been able to hold on only to owe much, much more money than they did at the beginning of all this. Basically, they've held on for the privilege of being able to pay back more debt in the future. Oh, just a little bit longer. You might get your freedoms back in a week or two. Oh, just a little bit longer. I'm Greg Staley from Diverge Media. We have videos coming out Tuesdays and Fridays at 7 p.m. Eastern. And make sure to hit the bell, like and subscribe, and check us out on divergemedia.ca to get a look at our work and all of our articles there. Thank you.